PreventS-MD. It's a clinical software for stroke prevention that assesses stroke risk, provides evidence-based tailored recommendations, and a goal settings option that can be transferred to the smartphones via QR code along with the notification. So basically, the software, it's at the clinic setting, at the hospital setting, but it allows that information that is produced by that software to be transferred into the mobile phone of the user, so that when they go home, they have the recommendations, the goal settings, and the stroke risk, which is calculated from the software on their hands in their mobile phones. So it enables the users to control their own risk factors, thus extending the stroke care continuum into the community, so from clinic to community. The software has received high usability scores on several surveys that we did. We interviewed around 100 clinicians from 27 countries, and half of those countries were low and middle income countries. And they all have given us a very high feasibility and usability rates. So the software was identified as time-saving, easy to use, and culturally adaptive, addressing to the needs of 5.5 billion people across 149 countries, and the software is translated in 24 of their native languages while keeping in mind their cultural needs. The results of our survey, the one that I presented at the conference, it showed that the global use of this digital tool, it would be possible in just over 5 years to reduce the stroke incidence by 20% and avert at least 300 million deaths in the next 5 years that would be attributed to stroke. And because the risk factors of stroke and many other non-communicable diseases, they are quite similar, this has a compounded effect on reducing the incidence of other major non-communicable diseases such as ischemic heart disease, dementia, diabetes, as well as some types of cancer. So needless to say, it would save global economy billions of dollars and cost significantly lower than the existing prevention tools. And when we implement it in combination with the existing population-wide strategies, the one that are already existing in the stroke prevention area, it can further increase the stroke prevention and reduction in stroke incidence. So our estimates were that if used with the existing community-based population-wide strategies, it can lead to 50% incidence reduction of stroke. And not only stroke, but for other non-communicable diseases also, which makes PreventS-MD the only complementary software currently available, which is validated and evidence-based and flexible enough to be implemented with even basic digital tools in diverse healthcare communities around the world. There are several clinically tested questions that we ask in this through this app, and there's an option to automatically populate those questions from the patient's data. And then once the clinician puts these questions, or the questions are automatically populated from the patient's clinical database, there's an option to calculate the risks. So risks, along with our legend stroke riskometer software algorithm, which has been there for last 10 years, we use several other algorithms like Life Essentials 8 and existing Framingham heart scores, and we compute an overall health scan kind of a discharge summary from this particular software, which is given to the patient, and the doctor gets the option to tweak the recommendations and and suggest certain goals, put their own tailored goals also into these options. So it's quite flexible. It allows clinician quite independence, as well as it gives the patients a handy discharge summary that can be transferred to their mobile phones from the QR code. So when we interacted with a few PHOs are more of primary health organizations in New Zealand. So these are agencies that look after the GP clinics, like group of GP clinics. So they suggested that there are several community health workers that would be largely benefited by such a tool, because it gives them certain those recommendations that don't require specialized clinical advice. It can basically be carried on in the community. Basically, things like smoking cessation advices and weight reduction advices that are quite personalized and tailored, which is not actually available when you do a regular Google search, because it will not be personalized. It will be quite general. Along with that, it also allows, a visualization of risk in 5 and 10 years, as well as allows the policymaker to see the larger picture of what's going on with the existing population-based strategies and the outputs from the software in graphical format. And we are working on more of geographical kind of displays also now.